Tidelands Health has extended the reach of treatment through peer support specialists, people who have been successful in the recovery process to help others experiencing similar situations. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. In our final installment in this three-part series, Tidelands staff will provide highlights of peer support training, as well as how they've been accepted by staff, clinicians, and patients. Moreover, they will share how peer support has improved patient outcomes, reduced return visits to the emergency department, and returned time to clinicians for other activities.
Thanks, Tom. My name is Rebecca Chickey, and I am the Director of Behavioral Health Services for the American Hospital Association. And it's my honor to host today's podcast, Extending the Reach of Treatment Through Peer Support Specialists. This podcast will explore how Tidelands Health has employed peer support specialists, people who have been successful in the recovery process who help others experiencing similar situations. Some call them patient navigators. Tidelands Health staff will provide highlights of peer support training, as well as how they have been accepted by staff, clinicians, and patients. Moreover, they will share how peer support has improved patient outcomes, reduced return visits to the emergency department, and has returned time to clinicians for other activities. I'm joined today by John LaRochelle, who is the Vice President of Operations at Tidelands Health in South Carolina. Welcome, John.
Thanks, Rebecca.
First, can you tell me a little bit about yourself and your current role at Tidelands?
Yes, I'm Vice President of Operations at Tidelands Health. I've been with the system for 28 years and been in administration for about 8 years. Among my other responsibilities, I currently help lead the effort in opioid reduction for the system.
And that is a significant problem, the tragedy of the epidemic across the country, but particularly in certain states, of which I know South Carolina is one, has borne a heavy burden. So thank you for your leadership in that area. Related to that, can you describe what a peer support specialist is and how they help Tidelands Health improve access to behavioral health services, which also includes addiction services, and life and recovery?
Sure. A peer support specialist is someone who is in recovery themselves, but has also received additional training in motivational interviewing, advocacy, public education, and co-occurring mental health conditions, among other things. They're provided through a grant in conjunction with the Medical University of South Carolina and are employed through Lighthouse, which is a local behavioral health center in the area. They're based in the ED, emergency department, and are engage appropriate patients about entering medication-assisted treatment. Once they're in contact with the patient, they also have access to a list of resources, not only related to drug and alcohol use, but also where to find food, shelter, clothing, and counseling. They also stay in touch with the patient once they have provided them with the initial referral to see if they're encountering any other barriers in receiving services following discharge.
John, as I hope most people listening to this podcast knows, that ability to have what I would call a touchstone person that can help you in your own journey, particularly with substance use disorder treatment and the challenges to living in recovery, is so important and so incredibly valuable. But how did you break down the barriers that often exist between clinicians, such as physicians, nurses, even social workers, and peer support specialists?
Well, I think getting the staff involved early on in the process as we develop the process in the ED certainly helped them understand the role of the peer support specialists. Although we weren't initially sure how they would be received by staff of the ED, it turned out that they were very well received by the physicians and the staff and have been a valuable resource of the department, and they are seen as such.
That's excellent. And it's a great example of how often sometimes we create barriers in our mind. I'm sure you had some concerns going into it, as you've described, and yet you were lucky to find the opposite, that any stigma that you thought might have exist, if it was there, it was minimal, and indeed the peer support specialists have been embraced. But in order to start this program, I'm assuming you had to have hospital and health system leadership to back you up. So how has the leadership supported the use of peer support specialists? And can you tell us about any barriers you encountered during the initial integration of this staff?
Well, one of the physicians on our staff is an addiction specialist, and so has been quite involved with a program outside the hospital and is familiar with peer support specialists and the value that they brought to engaging patients in crisis, and recommended individuals to receive the training through Lighthouse. As far as barriers, we recognized early on that we would need to engage a multidisciplinary team to establish the process flows and establish work, especially with IS, to create the triage piece that triggers the brief intervention in the ED. All the patients that come through the ED are screened through that triage process, and then again will be screened to receive the brief intervention.
That's great. What have you found, though, to be the biggest benefit, both planned and unplanned, of having peer support specialists on your team?
I think the biggest benefit is their ability to connect with patients more effectively than the hospital staff, which brings more people into treatment. They're also experts in providing certain resources. We also have expanded their services because of this to other inpatients in the hospital who may also be candidates for treatment and recovery.
Well, John, thank you so much for joining us today and for sharing and inspiring Tidelands Health's work with peer support specialists. Keep up the great work.
Thanks for having me, Rebecca.
If you'd like to learn more about the work that the American Hospital Association is doing on behavioral health, visit us at aha.org/behavioral health.